Good morning and welcome to Kelly's Anesthesia Tips. Today we're going to cover a topic that is tale as old as time, meaning that this question has been around for quite a while, and it is important for those of you that are in teaching facilities. So the age-old question is, are you required to report modifier GC or GE to non-Medicare plans? And I remember this going back at least 20 some odd years, but the one that I found online, I'll share all my links and all my resources with you and then let you make your own types of decisions. But I do want to give you the direction you need to look. So first, this goes back to 2012, 12 years ago, on the AAPC, the Coders Network, asking whether or not it has to be reported to modifiers. And the response was it was their understanding that they were limited to Medicare, but they could be wrong. And I appreciate when people say that, because on some of these listserv and discussion groups and stuff, you sometimes get opinions, you sometimes get facts, and you sometimes get a mix of them. And then sometimes you just get flat out wrong information. So you want to always look for those that have really good resources. So I'll be sharing resources with you, as I said, logic with you, and then make decisions on your own. So here it says, and I agree with them, it's best to contact individual commercial plans to see if they will accept the modifiers. And the person that asked this question was offline. And I did remember a friend of mine from the AAA from years ago going through the same issue with an insurance company not wanting to pay for their services when they appended the modifier. So let's look at some of this real quick. So your GC modifier, what is it and when do you use it? It recognizes that the services are done in conjunction with a resident, that's a physician. So the GC and GE modifiers don't pertain to any other type of student, like your student nurses or your CAAs, certified anesthesia assistant students. They don't pertain because they're not physicians. The second is it's an approved teaching program. So they have GME, graduate medical education, and Medicare and others fund this to the doctors so that they can teach. They don't get payment for them specifically because they're students, but there is a way to report the information and get paid for services when you are documenting the services. There's also an exception, which we'll cover briefly. I always enjoy these because I couldn't tell you if you'd asked me yesterday what the exception to the rule was. But when I start digging into finding the resources for you, I find that there are sometimes exceptions. So when I say I'll share these resources with you, of course there will be many, many more resources, but the ones that I'm finding, I tend to think, because they're Medicare transmittals and Medicare information and policies, that it is good and legitimate information. So here I didn't share, but I will share the link. This is a children's teaching hospital that says they report with Medi-Cal, that is the Medicaid carrier out in California, and then Medicare, which we are all familiar with in all of the states. They do have an exception, so we'll hop over and look at what the exception might be. But first I want to take you to the CMS guidelines. So these were just updated not long ago. You want to find your most up-to-date. I had this already on the page for the teaching physicians, but I'm going to scroll back to one and just show you how you can tell the most up-to-date. So this was last updated in August of 2023. It's available. I'll give the link. And as I said, they do explain what their expectations are as far as documentation. Now, you know that sometimes anesthesia does do E&M, rarely, but we do. If there's an exceptional patient that requires more than just the routine pre-anesthesia assessment. You might have that if the case is canceled and you don't provide the anesthesia service, but you have a fully completed pre-anesthesia assessment. If it was canceled prior to the induction, you will be reporting an E&M for most cases. I've seen a few policies out there that have some weird reporting guidelines for canceled cases, but for the most part, these are what Medicare expects. And my advice for that is always just check with whoever the payer is for that particular patient. You can't always follow the same rule for everyone, which is kind of what I like about this. Could be frustrating, but it also keeps it very interesting. So here is where I saw there is an exception, not just to E&M services, but that says you have a GE modifier associated with the primary care exception, which I will then say, okay, what is the primary care exception? And you'll see it won't really apply to anesthesia made to pain management, but for teaching physicians providing E&M, and we do sometimes, so it could apply to us. There is a primary care exception that allows them to not report or to report their services without the documentation of the teaching physician in certain circumstances. And it goes through all of that here. I won't read it, but I will tell you again that I'm going to give you these resources. Okay, so now I want to talk about some commercials, because this is, and I guess I probably should, let me hop over to how I responded to the question myself. It was very much in line with what the person said on the AAPC discussion group. So when I talked to this person, I said, Medicare does require these modifiers, but they pay into resident programs, and apparently Medi-Cal as well, or other Medicaid payers. It is always best to check your own area, your own geographical area, to see what they say. Now, commercial payers are private entities, they're for-profit, and although their policies may address accepting these modifiers, they don't pay anything into the resident programs. So I'm going to show you an example of United Healthcare that does address this. But I highly recommend that if you're reporting these to commercial insurances, any commercial insurances, then they're not paying you the same way Medicare does, which is no reduction in payment for teaching up to 2 residents at a time under a teaching physician, then you want to make sure that you're not getting your payment reduction. So if I were auditing and I came in and I saw that you had reported GC to a commercial payer and they reduced your payment by 50%, I'm making this up, then I would say, okay, we have a problem here. I think you should stop reporting these modifiers until you get this figured out, because you're going to have to reach out to that insurance company to find out why are you reducing payment, or even denying, because that was what was happening many years ago with a friend of mine when we're reporting the modifiers. So you want to make sure that they understand what Medicare's perspective is on that, and if they're going to try to follow that program and follow the modifiers, that they're doing the same thing that Medicare does. So the response from my friend that I had reached out to, that's why it's in quotation marks, and I didn't ask her permission, so I'm not going to share her name, but I'll tell you she's in New York, and it was a long time ago that they had insurances denying for it. So she said that in her area, which is New York, big state, we had to specifically and separately negotiate excluding modifiers, and that worked for a while, but with automation and consolidation, the payers are having trouble processing our exception logic. So I'm going to imagine that they're working on that, because you have to. You do not want to reduce payment to your teaching physicians who are doing what they've been asked to do, which is teaching the next generation. So let's go look at that United Healthcare policy. This is their current, it says 2023, but again, they will give, I'll come back to page 3 on this, they will give at the bottom the last time they reviewed it and how long that policy has been here, this one at any rate, since 2021. They are subject to change, but I will give United Healthcare this. Their policy is available online and easy to follow. They have Q&A that is easy to follow. So I appreciate that from United Healthcare. And if they do have problems processing the claims with modifiers or following their own policies, you have to bring it to their attention. So here, they're telling you that basically they're following Medicare's policy. I'm going to go back to that section as well, not trying to make you dizzy. But it says, consistent with CMS, United Healthcare will not reimburse services by residents, interns, and medical students as identified by the Medical Student Healthcare Provider Taxonomy Code. But they will follow CMS guidelines if they document they perform the services. And they do also mention this primary care exception. So they're giving you the modifiers, they're giving you the description of the modifier, and telling you that they follow CMS guidelines. If for any reason they do not, this insurance, the reason why I use United Healthcare is because they do give a clear policy on their website. So it's available to anyone to pull. You may have to do a little bit of research of your own for whatever specific policy you're looking at. So again, I will give these links. And you know I like to end with my usual, but before I do that, I want to share information that if you have not yet heard, that was so generous that I highlighted it on my tagline that I like to end with. So I hope I pronounce this correctly. Mrs. Ruth Gottsman, could be Goatsman, but I'm going to say Gottsman, provided a $1 billion donation to Albert Einstein College of Medicine. And if I'm not mistaken, that is also in New York in the Bronx. So this is making free tuition available to all students going forward. And I really hope that this kind and generous donation is going to give us a lot of new students at this school. So I was curious about the family, because, you know, that's a very generous donation. So apparently both Ruth Gottsman, and her husband David are from New York, have invested in that area. She's on the board of Albert Einstein, which makes perfect sense of why she would want to support this. But, you know, they've worked. They worked their way through life, as we all do. Had a smart relationship early on, apparently, with Warren Buffett. And if you know anything at all about stocks, Berkshire Hathaway is the most expensive dollar stock on the entire market. I looked that up once just because I was curious. I didn't bother with that, but you're free to Google. At any rate, thank you. Thank you for your generous and kind donation. Thank you all for your time. Be kind to one another, generous with your knowledge. Thank you to my friend from New York. You know who you are. So if you watch this, thank you. If you subscribe for new content, you get notified when these update. And once again, I appreciate your time. This was one of those questions that people send that I thought would make a good YouTube. If you have one, or if you have some experience you want to share regarding this topic, please feel free to leave comments. Thank you much, and see you next time.